Hey everyone! Tonight we're opening a file on something a little different. The history of surgery. Back when surgery mostly meant a steady hand, a sharp object, and an alarming amount of confidence. So before you get comfortable, take a moment, like the video, and subscribe. But only if you genuinely enjoy what I do here. And let me know in the comments where you're tuning in from and what time it is for you. It's always nice to know who's drifting off with us tonight. Now dim the lights, maybe turn on a fan for that soft background hum, and let's ease into tonight's file together. We're going to travel across 4 ancient civilizations, and in each one, you're going to be the patient. Try not to think about that part too much. Imagine waking up in ancient Egypt with a gash across your arm, deep enough that you can see more of yourself than you'd like to. You are carried, or perhaps you stumble, toward the home of a physician priest, a person who treats the body and appeases the gods in more or less the same appointment. Egyptian medicine did not separate the practical from the spiritual. If you had a wound, you received a dressing. You also, quite possibly, received a small prayer to Sekhmet, the goddess associated with both plague and healing, on the theory that it never hurts to cover every possible angle. Ancient healthcare, as we've established before, was very fond of covering every possible angle. What's remarkable is that underneath the incantations, there was something genuinely scientific happening. We know this because of a document called the Edwin Smith Papyrus, named not for an ancient Egyptian, but for the 19th century American who purchased it in Luxor, which feels like a very ordinary way for one of the oldest surgical texts in human history to end up with a name like Edwin. The papyrus describes 48 case studies, mostly trauma injuries, and it reads less like a spell book and more like a clinical file. Each case follows the same format: a description of the injury, an examination, a diagnosis, and then, in a detail modern doctors would probably respect, an honest verdict on whether treatment is even worth attempting. Egyptian physicians sorted injuries into 3 categories: an ailment I will treat, an ailment I will contend with, and, somewhat bluntly, an ailment not to be treated. There was no attempt to soften that 3rd category with hope or reassurance. If your injury landed there, the physician simply told you so, which is either refreshingly honest or the worst bedside manner in recorded history, depending on how you were feeling that day. For the ailments that were treatable, the methods were surprisingly sound. Wounds were cleaned. Fresh meat was sometimes applied to a bleeding wound on the first day, likely to help stop blood flow, before switching to honey and grease for the following days. This sounds unusual until you remember that honey has genuine antibacterial properties, something Egyptian physicians could not have explained in those terms, but had clearly learned through centuries of watching which wounds healed and which did not. Fractures were splinted using wooden supports padded with linen. Dislocated joints were reduced using leverage techniques that, if you described them to a modern orthopedic surgeon without mentioning the date, would not sound especially out of place. Sutures were used to close wounds, often made from linen or animal sinew, and closed with a technique very close to what you'd recognize as stitching today. The tools of the trade were bronze: knives, needles, small saws, forceps for extracting foreign objects. If you were unlucky enough to require surgery on the battlefield, you would find yourself treated with impressive speed because Egyptian military campaigns generated more trauma cases than almost any other setting available, and practice, however grim the source of it, made physicians better. There was even early evidence of trepanation in Egypt, though nowhere near as common as in other ancient cultures. The practice of cutting or drilling a hole into the skull, sometimes to relieve pressure from head injuries, sometimes for reasons historians are still debating, and sometimes we can only assume because someone was very sure it would help and nobody was in a position to argue. What stays with you as you leave ancient Egypt behind is the sense of quiet method underneath the ritual. These were people without germ theory, without anesthesia, without any real understanding of infection, and yet they built a working system anyway, one built entirely on the patient observation of what happened the last time, and the time before that, and the time before that. You travel now to ancient India, to the world of a physician trained in a tradition eventually written down as the Sushruta Samhita, one of the great foundational texts of Ayurvedic medicine, and quite possibly the most advanced surgical document anywhere in the ancient world. The text is attributed to Sushruta, a physician often called, with only mild exaggeration, the father of surgery. Whether Sushruta was a single historical person or a name representing generations of accumulated knowledge is still debated. Either way, the achievements credited to this tradition are extraordinary for their time, and in some cases, extraordinary for almost any time before the modern era. Consider rhinoplasty. In ancient India, judicial punishment for certain crimes sometimes included amputation of the nose, which meant there was, unfortunately, a steady demand for reconstructive surgery. Sushruta's tradition developed a technique using a flap of skin taken from the patient's own forehead, carefully shaped and grafted to reconstruct the nose. This is, essentially, the ancestor of a technique still used by plastic surgeons today, sometimes still referred to as the Indian method. It is a genuinely strange feeling to realize that a 2,000-year-old surgical text is still cited, however loosely, in modern medical literature. Then there's cataract surgery, performed with a procedure called couching. A needle-like instrument was used to push the clouded lens out of the line of sight within the eye, restoring at least partial vision to patients who would otherwise have gone permanently blind. It was not without risk, and it was not a cure in the way a modern lens replacement is, but for a patient living with total blindness, even partial restored sight was, by any measure, an enormous outcome. This procedure would not be meaningfully improved upon in most of the world for well over 1,000 years. The text also describes more surgical instruments than you might expect from any ancient tradition. Well over 100, according to some translations, including variations of scalpels, scissors, needles, and forceps, alongside detailed classifications of different types of sutures based on the material and the location of the wound. There's something almost bureaucratic about the precision here, a system that clearly wanted every future physician to be working from the same detailed catalog rather than guessing. Sushruta's tradition also placed heavy emphasis on the qualities required of a good surgeon: steady hands, a calm mind, courage under pressure, a willingness to continue practicing on artificial models, fruits, vegetables, and dead animals before ever touching a living patient, which is a genuinely sensible teaching method and also mildly reassuring, since it means somewhere in ancient India, a very serious apprentice surgeon was earnestly practicing incisions on a squash. Anesthesia, in the modern sense, did not exist. Patients undergoing procedures were sometimes given alcohol or other preparations to dull the experience, and were frankly expected to endure a great deal. And yet the level of anatomical understanding on display, the classification systems, the surgical planning, all of it suggests a tradition that was not improvising, but working from a genuinely sophisticated body of accumulated knowledge, refined over centuries by people who took the responsibility of cutting into another human being extremely seriously. From India, you travel west into familiar territory, the world of Hippocrates and later Galen, the two names that will echo through medicine for the next 2,000 years, regardless of how much of their advice eventually turned out to be wrong. Greek surgical philosophy carried a very particular attitude, one that still shapes medicine today. Surgery was a last resort, not a first instinct. The Hippocratic tradition placed enormous weight on observation, cleanliness, and the belief that the body had its own natural tendency toward healing, which the physician's job was to support rather than override. If a wound could heal on its own with rest, careful dressing, and time, that was always preferable to opening someone up. But surgery still happened, and often under circumstances considerably less controlled than a physician's quiet study. Battlefield medicine was where Greek surgical skill was truly tested. Arrow wounds, spear wounds, crushed limbs from falling debris or trampling. Physicians accompanying armies developed genuine expertise in extracting foreign objects from the body, a skill that required not just steady hands, but a real understanding of anatomy, which vessels to avoid, which organs sat where, how deep was too deep. One of the more fascinating threads in Greek medical history involves gladiatorial combat, and specifically the physician Galen, who spent several years early in his career treating wounded gladiators in the city of Pergamon. Human dissection was culturally forbidden in much of the Greek and later Roman world, which left physicians with a frustrating gap in their anatomical knowledge. Gladiators, unfortunately for the gladiators, but fortunately for medical history, provided Galen with a window into the human body that almost no one else at the time had legal access to. Stab wounds, crushed bones, torn muscle. Galen documented all of it, and in doing so, built an understanding of human anatomy that would remain the dominant medical authority in Europe for well over 1,000 years. There's something quietly ironic in that. One of history's most influential physicians learned much of what he knew, not from careful academic dissection, but from an entertainment industry built on violence. Galen himself seemed aware of the strange privilege this gave him, later writing extensively and confidently about anatomy in a way that suggests he knew exactly how rare his access had been. Greek surgical tools were similar in spirit to those in Egypt and India. Bronze and iron scalpels, hooks, probes, and cauterizing irons used to seal wounds and stop bleeding through heat, a method that was as effective as it was, by any modern account, absolutely horrifying to actually undergo. Cauterization remained a standard technique for centuries, largely because it worked, even though nobody involved would have described the experience as pleasant. What Greek medicine ultimately contributed beyond any single technique was a philosophy, the idea that disease and injury had natural causes, that careful observation mattered more than assumption, and that a good physician should ask questions before reaching for a knife. It's a strangely calm foundation for a field that so often, out of necessity, involved a great deal of blood. Finally, you arrive in Rome, inheritor of Greek medical philosophy, but with a distinctly Roman talent for organization, infrastructure, and doing things at scale. Roman military medicine was, frankly, ahead of its time in terms of logistics. Legions were often equipped with dedicated medical staff and field hospitals, known as valetudinaria, structures built specifically to house and treat wounded soldiers, complete with separate wards, ventilation, and drainage. Details that suggest someone, somewhere in the Roman military bureaucracy, had thought seriously about hygiene, even without understanding germ theory. It would take many other militaries well over 1,000 years to reach a similar standard of organized field medicine. Some of the best evidence we have for Roman surgical practice comes, somewhat morbidly, from Pompeii, buried and preserved in the eruption of Mount Vesuvius in 79 AD. The House of the Surgeon, as it's now called, contained a remarkable collection of bronze surgical instruments, scalpels, forceps, hooks, catheters, and bone levers, many of which look almost unsettlingly familiar to anyone who has seen a modern surgical tray. The basic shapes required to cut, hold, and probe the human body, it turns out, have not changed nearly as much as you might expect in 2,000 years. Roman physicians performed cataract couching, similar to the Indian technique, along with dental extractions, the setting of fractures, and even early forms of cesarean delivery, though almost exclusively performed after the mother had already died, in an attempt to save the child. A grim but historically documented practice, and part of the origin of the procedure's name, tied to Roman legal tradition requiring the attempt. Roman medicine, however, also had a persistent weakness, an enormous confidence in the theory of the four humors, the idea that the body was governed by blood, phlegm, and two forms of bile, and that illness resulted from an imbalance between them. This theory led to widespread use of bloodletting, a practice believed to restore balance by draining what was considered excess blood. It would remain popular for well over 1,000 years after Rome fell. Applied to an enormous range of ailments, it almost certainly did nothing to help, and in many cases actively worsened. It stands as a useful reminder that confidence and correctness are not, historically speaking, the same thing. And yet, alongside the humor theory and the bloodletting, Roman physicians such as Celsus documented surgical procedures with impressive clinical detail, descriptions of removing bladder stones, treating hernias, and performing amputations, complete with guidance on where along a limb to cut in order to preserve as much healthy tissue as possible. It's a strange mixture. Technically skilled procedural medicine sitting right alongside theoretical ideas that had no real basis at all, and both delivered with exactly the same tone of professional certainty. And so, as you drift back out of ancient Rome, out of Greece, out of India, and out of Egypt, a pattern becomes clear across every culture you visited tonight. Different tools, different explanations, different gods being asked for help along the way, but the same underlying instinct: careful observation, patiently repeated, slowly turning guesswork into method, and method into something that, centuries later, would eventually become the medicine we rely on today. None of these physicians had anesthesia in the way we understand it now. None of them fully understood infection, and yet, case by case, wound by wound, they built something real. That's the file for tonight. Get some rest. We'll open another one soon.